I get asked about this all the time. You actually see it on like a lot on TikTok and actually on Instagram in some of my question inbox. It's about keratosis pilaris. Keratosis pilaris essentially describes those kind of bumpy lesions that you get around hair follicles on areas like the arms, backs of the legs, even the buttock area. You can get it in your youth. It's a youthful skin condition. Most of the time, actually, as you get older, it does disappear without treatment, but it can be highly distressing for people. And actually, you see a lot of things online about keratosis pilaris. In fact, there's a lot of essentially formulations made specific for the condition. So it essentially describes buildup of keratin around that hair follicle. So build up within that area. Sometimes it can cause inflammation. So if you're a lighter skin type, you can also see redness around that hair follicle and that bumped, raised texture. Now your immediate thing is, let's just scrub it down with a really kind of like, even a stone, you can just really kind of like shave it down. No, please don't do that. It causes micro tears within the area. It can break the skin a little bit more, cause more of a rougher texture, also create more inflammation, and you can end up getting scarring as well. So you really have to treat this in the right way. Physical exfoliation, no good. Chemical exfoliation actually is very nice. And one particular acid that I always recommend patients is salicylic acid. As it happens, one of the most popular skincare brands, CeraVe, have 3 products for it. They've got the salicylic acid cleanser, as you know, and then you've also got the smoothing cream as well as the lotion as well. So look, I get a little bit of keratosis pilaris on my elbows. I do use a different salicylic acid. I use a different salicylic acid wash in the shower. I use the IS Clinical one, which is like a body complex wash, which is actually fantastic, a blend of different acids. And then I do use this SA smoothing cream afterwards. And what that does is help just essentially break down those dead skin cells over the area, resulting in a smoother appearance. It will not get better from 1 week of treatment. It actually takes months to get better. So you need to build on it. And eventually you probably can get about 50 to 60% reduction in keratosis pilaris in that way. Some of you are gonna be listening and thinking, right, how can I just get rid of it though? What can I do? Well, look, it's all centered around the hair follicle within that area. So technically, to get rid of actually a large proportion of it, especially if you've got it around the legs and arms, which are higher hair-bearing areas, then yes, things like laser hair removal that essentially destroy the follicle can really help with the improvements of keratosis pilaris. Just remember that when you're having laser hair removal, you've got to shave the hair. Shaving of the hair can temporarily worsen the keratosis pilaris. So it's really important that your at-home care, talking about creams such as the CeraVe cream and the other ones that we're going to be talking about that are specific to keratosis pilaris, using these creams are really important. Lifestyle choices are extremely important too. So use warm water when you're in the shower, not too hot because that can make things worse and damage the skin barrier. Always moisturize, as well as maybe even have a humidifier if your house has got really dry air. So here are my top tips. We've talked about the CeraVe. I think that's pretty good. The other one that I've got on my list is the Inky List BHA toner. I think that's quite nice for specific small areas. So if you've got like kind of around the elbow some dry skin and keratosis pilaris in that area, then it can be very, very useful. One that I saw that was in areas where I had stubborn keratosis pilaris that worked really well was the TCA multi-acid body pill. And I thought it was quite strong, and I did need to protect my barrier afterwards. So in the morning time, I'd put the TCA body pill on, wear my clothes in the winter time, and in the night time, I would put an emollient and even actually some Aquaphor, so a skin barrier, just to help moisturize that area afterwards. There are some specific products such as the DRMEDISPA 10% AHA. It's a scrub. It's actually a little bit harsh, so you got to be really careful. Although the formulation is great, the actual fact that it's a scrub actually takes away from the aspect of it, which is not great. Medical wise, when in the clinic, Abaji, one of the biggest medical brands, reduced keratin, and actually the studies show a fantastic reduction just by using that cream. It's a lot more gentler. You won't need to scrub, you won't need to do much. It comes in a slightly smaller bottle, so it's actually quite expensive. But actually the Abaji keratin for my wife really worked so well, and I got great feedback from it. Here's the summary of Keratosis pilaris. It does generally fade away with time. I think that if you see that as soon as you see it, if you don't like the hair in the area, getting laser hair removal early on is going to be a good call. But also changing your lifestyle, as well as making sure that you're moisturizing and also putting the right things on after you come out of the shower, are essential to reduce this slowly over time. And yes, it's one of those things, you have to keep working at it. You may not even see benefits even after 2 months. So you really have to stick to it. If there's any other questions that you have for Keratosis pilaris, just let me know. If there's any other conditions you want me to talk about and how you can essentially not cure them, but maybe help them along a little bit and improve the symptom profile, then just let me know. Thank you so much. Take care.